Hi, I'm Brian. My journey with cancer started in 2007. I had some pain in my leg under my hamstring, and they ended up finding out that it was cancer in my leg. So in the beginning of 2008, I had a removal that went from above my knee up to my rear end. I ended up having about 30 days of radiation. I went for a little over 5 years, going every year for follow-up MRIs, and everything was good until the fifth time. And so approximately within a few months of that, I had a biopsy, and they went ahead and thought they removed the whole thing. They went up against my sciatic nerve. About a year later, in another scan, they saw something again, and so I ended up in 2016, in July, I had a removal of my sciatic above my knee up to my rear end, along with the growth. Then in a follow-up in January of 2017, they did a precautionary scan on my lung, and they saw a lump there. So I had a friend that was a doctor, and he recommended that I come to see Dr. Nezami because of the recurrence and the fact that it had crossed over my diaphragm, and they also believed that it was the same thing as in my leg, which was a liposarcoma. So I started taking treatments, and in the meantime, the doctors for my regular provider decided they wanted to do surgery on my lung. And so I went for treatment and delayed the surgery for a little while. And then they did some testing on me, on my blood, and original testing had shown that all the markers were there. I had marker for the stem cell activity, marker for the cells splitting, and marker for the DNA being altered. So after the treatments, the first session, my stem cell activity had stopped, and the other two markers had been reduced, but they weren't where they wanted them to be. So I took a couple of more treatments before I had surgery. I ended up having my left lower lobe removed from my lung, which was about 3 weeks ago. So I came back the following week right after surgery. I had 8 treatments, and then I had some blood taken last Monday, and the doctors have me just coming back a couple times a week until we get the test results. So I'm going to looking forward to the next round of testing coming up, and hope that at some point I'll be cancer free. So far the treatments have been going fairly well. For me, side effects were just maybe I felt a little tired, but I haven't felt ill, and just been a good experience here at this office. Has been very positive, and I've just heard nothing but good results. So I'm just looking forward to that being the same for myself.